Everyone, I hope you all are doing well. Today, our topic will be a brief discussion regarding the vasculature to the thyroid gland, blood supply, its venous drainage. It's very important and interesting topic regarding the thyroid gland. So here we will start with the introduction to the thyroid gland. Usually, thyroid gland is known as butterfly-shaped organ. It's a butterfly-shaped organ which has a texture of red brown colored. It's an endocrine gland having endocrine properties. What is the location of the thyroid gland? It's usually situated in the midline of our anterior neck. It is usually situated in the midline of our anterior neck. Usually, on average, our thyroid gland it extends from level of C5 vertebra up to T1 vertebra. This is the anatomic location of our thyroid gland. Do remember this. This is the anatomical location of our thyroid gland, and on approximately our thyroid gland usually weighs up to 15 to 25 gram. It usually differs according to the different books, but it is average weight of our thyroid gland, and it is also known as the largest gland of our endocrine system. This is an important point we should remember, that it is known as the largest gland of our endocrine system, largest endocrine gland, we can say. Our thyroid gland is usually encapsulated in pretracheal part of deep cervical fascia. You must know different types of fascias present. We must have discussed it in our anatomy classes. Our thyroid gland is bilobed, having two lobes. It has having two lobes. We can briefly draw the structure of our thyroid gland. Here, this is the first one lobe and second lobe, and these two lobes are connected by a bridge. We can see here. This is connected by a bridge, and this connecting bridge is known as isthmus. This connecting bridge is known as isthmus of the thyroid gland. So this was a brief introduction about thyroid gland. Now we will move out to our main topic for today, which is blood supply to the thyroid gland. So starting, we will make a rough diagram of thyroid gland. So here you can see these are bilobed, the first and the second lobe, and here in this you can see the isthmus is present. This is the isthmus. We can mark it. Isthmus. These are lobes. So here we will see the blood supply to this thyroid gland. So starting with the upper pole, here you can see here is an artery present. This is an artery, and this artery is providing, this artery is giving branch which moves to the upper superior border of the thyroid gland and run towards the superior part of the thyroid gland up to the upper pole of upper surface of isthmus up to here, and one of distributary enter to the superior part of the thyroid, and with just entering the thyroid it terminates here, just a short course. So from this part, the artery from the main artery from which these two arteries are coming, this artery is known as our main artery. This is known as external carotid artery. This is our external carotid artery, and the artery which is coming from this up to the upper surface of the isthmus and to the upper pole of the upper part of the thyroid gland, this our artery is known as superior thyroid artery, one of the main arteries in the vasculature of the thyroid gland. So this was at the upper, and if we see from the below, from below we are having, we can make this roughly, we are having this thyrocervical trunk. And for your kind information, this cervical trunk, it is it's from the first part of subclavian artery. I hope you are not having any confusion regarding this thyrocervical trunk, which is the first part of the subclavian artery. I will just clear your confusion regarding this. Usually our subclavian artery is divided by a muscle which is known as scalenus anterior. I will show you in a brief diagram like this. This is our muscle which is known as scalenus anterior, which divides our subclavian artery into three parts. Usually if our subclavian artery is running through, the first part is which is proximal before proximal to this muscle, the second one is when it is inside the muscle, and the third part is distal to this muscle. This is the first part of subclavian artery, this is the second part of subclavian artery, and this is the third part of subclavian artery. And here we have to relate this to the our thyroid gland, and the thyrocervical trunk, it arises from the first part of subclavian artery here, and we have to discuss it here as a thyrocervical trunk. The thyrocervical trunk give rise to a branch which is known as, which enters from the lower lobe of thyroid gland and gives numerous branches. It gives numerous branches here, and the main, it moves upward up to here, and the numerous branches are terminated here, and this artery is known as inferior thyroid artery. Inferior thyroid artery. Do remember guys that this inferior thyroid artery which is running from the inferior part of the thyroid gland entering up to the upper, this is also a main supply to our parathyroid glands. You should also remember that one more artery, is running from this, with this artery. Here it is having an surgical important that a nerve is running through along the course of the superior thyroid artery, and this nerve is known as external laryngeal nerve. And also from below with the inferior thyroid artery, another nerve is running along its course with it close to its proximity, and this is known as a recurrent laryngeal nerve. That's why we have to, during surgery, during surgical excisions, we have to keep this mind while while dissecting or while ligating these type of arteries, that we shouldn't harm, we shouldn't injure these nerves, because doing damage to these nerves, these can cause much damage to the nerve supply of the particular area. So this was it. Another important point is that we are having, let us suppose this is the arch of aorta, arch of aorta, and this is the brachiocephalic artery. And in rare cases, not, it is not common in all people, but in rare cases, either from this or either from this, and have are having two arteries which join here to form a common artery which goes up to the lower portion of the isthmus to supply the lower border of the lower portion of the isthmus. It's this artery isn't a mixture, it's an composition of these two arteries, either from the brachiocephalic artery or arch of aorta, and this artery is known as thyroidea ima. What is thyroidea ima? It's not usually present in all people, but in rare cases, approximately 10 to 15% of the people, that one artery from brachiocephalic artery or either from the arch of aorta combines to form a common artery known as thyroidea ima, which goes to the lower border of the isthmus and supply there. So this is the brief and complete vasculature, arterial vasculature of the thyroid gland. And if we move on to the venous drainage, venous drainage is not so complex. If we take on one part, if we take on one lobe of thyroid gland here, and here runs our main vein, from main vein, which is known as, you must have know this name, it's internal jugular vein. It runs along this course here below, and below it is having another vein which joins with the internal jugular vein here, and this vein is subclavian vein, and both these veins form a combined vein which is known as brachiocephalic vein. Most of the venous drainage occurs in this particular part of the venous system, and here the first vein drains into internal jugular vein which is known as superior thyroid vein. Another vein also drains into the internal jugular vein which is known as middle thyroid vein, and one vein which directly drain into the brachiocephalic vein, it directly drain into the brachiocephalic vein which is inferior thyroid vein. And if present, there is sometimes present fourth vein. If we see here, sometimes present fourth vein which is known as vein of Kocher. It also directly drain into the internal jugular vein. Now into the, while seeing venous drainage of the thyroid gland, usually it have four veins. One is superior thyroid vein which also drains into the internal jugular vein. Another is middle thyroid vein which also drains into the interjugular vein, and another one is inferior thyroid vein which directly drains into the brachiocephalic vein, and if present vein of Kocher, it also directly drains into the internal jugular vein. This is the brief venous and arterial system of our thyroid gland. Thank you. I hope you will find it useful.